All right, let's dive in. We're taking on the agency worker today by the Maverick.
Yeah, the one you all sent in about Susie, the mental health nurse.
And this one really spans her whole career, starting way back on the front lines and going all the way up to director.
It's more than just a career story, though.
Oh, for sure.
The Maverick uses Susie's experiences to, give us a glimpse into the inner workings of healthcare systems,
Yeah.
the dynamics of leadership, and how things look from the outside versus how they actually are.
And right away, we see Susie doing things her own way.
Like how she'd call in sick, right? Giving her managers a heads up the day before when she needed a mental health break.
Interesting.
It's subtle, but that detail says a lot about her even early on, attuned to the human side of things.
Definitely.
Recognizing how important mental well-being is in a high-stress job like nursing, and it makes you wonder if that played a role in her becoming a leader.
Yeah, because she does climb the ladder, right?
Mm.
Becomes director. Seems like she's hitting all the marks of success. You know, the respect from colleagues, financial stability, even winning awards.
Right, right.
But then it gets interesting because the story doesn't shy away from the disillusionment
Yeah.
that can come with all that outward achievement. Susie starts feeling this emptiness, like something's missing, even though she's checking all the boxes.
It really makes you think, what does success actually mean in a field as demanding and emotional as healthcare?
And that's where her conversation with Professor David really hit me. He brings up this idea of the dilemma of soul,
Oh, yeah.
suggesting that maybe succeeding in these systems means making compromises, like maybe part of Susie's success, involve keeping certain illusions alive within the system, even though she could see through them.
Heavy stuff.
Yeah, it really is.
It challenges us to consider the ethical tightropes that professionals in these fields often have to walk, and David doesn't stop there.
No, he doesn't.
He poses those thought-provoking questions about CEOs and that whole EPA policy example.
Right? Like challenging us to think about the limits of top-down decision-making.
Yeah, how even well-intentioned policies can have consequences that nobody saw coming.
Okay, so we've got Susie the insightful, maybe a little disillusioned
Yeah.
director, but then we meet Henry, her ambitious apprentice.
Total opposite style, right?
Totally.
Henry's super competent, driven,
Yeah.
but his connection with the staff on the front lines feels so different from Susie's.
Yeah, and that contrast, I think, is key to understanding how leadership works in this system.
Right. Susie built respect from years of being on the front lines, understanding those challenges firsthand. Henry's brilliant, but he's seen as more of an academic manager.
Yeah.
His authority comes from his position, not necessarily from, deep lived experience.
Which is probably why it's so ironic when he's initially passed over for a director role.
Totally.
They tell him he's too valuable where he is.
Right.
Like, too good at managing this problem unit to be promoted.
It shows this weird situation where being really good at a lower level job can hold you back.
Makes you wonder about the system's priorities, for sure.
For sure.
And then Susie throws a curveball. She resigns.
And this is where her perspective really starts to shift. Moving into agency work shows her a whole different side of healthcare, one she couldn't see from the director's chair.
Yeah, and it challenges some of her assumptions.
Like about agency nurses, right?
Right.
Turns out they're not less competent or less engaged like the stereotype suggests.
This is where personal experience becomes so powerful. It makes us confront our own biases, even the ones we don't realize we have.
Right.
The story does a great job illustrating this with the anecdote about Carl, the patient who wants to go for a walk.
Oh, yeah, I remember that one.
The permanent staff are so focused on tasks and paperwork that something as simple as a patient wanting a walk gets pushed aside.
Yeah.
And when Susie, as an agency nurse, offers to step in so someone else can take Carl, she's told, no, it has to be familiar staff.
Wow.
It just highlights these totally different priorities of ways of working, you know?
Yeah, totally different approaches. Yeah, it really exposes this possible gap between what we think good patient care should be and how these systems actually work.
Wow.
The paperwork, the routines, they become so ingrained that sometimes the human side gets lost.
And it's not that the staff don't care, right?
Right.
It's more like they're trapped in a system that prioritizes certain things over others.
Exactly. And it makes you wonder, are these systems actually encouraging behaviors that might not be the best for patients?
Something to think about.
Especially if you're ever the patient yourself.
Yeah, for sure.
Susie's move to agency work really opens her eyes to all these subtle things.
Like the cultural differences she starts to notice.
Yeah.
It's not just about work styles, but how those differences are seen and judged, especially in leadership roles.
Remember Blessing, the agency nurse from Nigeria.
Yeah, she was great.
Her experiences really show how easy it is to misinterpret someone's actions based on your own cultural background.
Without even realizing those same actions could mean something totally different in another culture.
Ex
Her points about eye contact were fascinating.
Yeah.
Like in her culture, avoiding direct eye contact can be a sign of respect.
Especially towards elders or authority figures.
Someone from a different background might see that as being evasive or disrespectful.
It makes you realize how much we just assume about our own cultural norms and how those unspoken rules can lead to misunderstandings or even conflict if we're not careful.
And it's not just about eye contact either. Blessing shared that story about her friend who got in trouble for folding his arms while a manager was talking to him.
Oh, wow.
He was just trying to show that he was paying attention,
Right.
but it came across as disengaged or defiant.
Yeah, it just shows how even small gestures can have all this cultural meaning.
And those meanings can affect how someone is seen at work.
Definitely.
This ties back to what Blessing said about Caribbean nurses often being labeled as bossy.
It's a loaded word, isn't it?
Yeah, it makes you wonder how much of that perception comes from real differences in behavior
And how much is based on cultural stereotypes.
that we might be holding on to without even knowing it.
That's a crucial question, and it gets at the bigger issue of unconscious bias, especially in a field as diverse as healthcare.
Right, Susie starts to see this herself, recognizing that assertive leadership from certain cultural groups can be seen negatively just because it's different from the norm.
Yeah.
Which leads us to one of the most thought-provoking parts of the story.
Susie's reflections on judgment and bias.
She starts to realize how easily personal feelings can affect professional decisions, especially when it comes to things like potential malpractice.
The example of the insulin incident is so powerful.
Totally.
It shows this point so well. She imagines how she, as a former director, might have handled that situation and starts to wonder if she would have been truly objective.
Yeah,
It's a humbling realization.
totally. We like to think we're rational and unbiased, but this story suggests that our feelings and experiences inevitably shape how we see things, even in our professional lives.
Right.
And those interpretations can have real consequences.
Especially in a field like healthcare where decisions can really impact people's lives. Susie's story is a reminder not just for healthcare professionals, but for anyone in a position of authority to be aware of their own biases and how they might be influencing their judgments.
It's not about being perfect or claiming to be totally unbiased.
Right.
It's about acknowledging that those biases exist and actively working to minimize their impact.
And then there's that ending, so simple but so profound. Susie's retired, enjoying her garden, and a young boy asks her, "How many did you cure?"
It's a child's question, but it gets to the core of what it means to work in mental health.
Yeah, it forces her and us to confront the complexities of curing in a field where healing is often a long and nuanced process, not a clear-cut endpoint.
It really makes you think about the nature of success in a field like this, and that question, how many did you cure?
It leads right into Susie's last conversation with Henry.
Oh, yeah.
You know, he's finally reached that director position.
He has.
But their phone call shows this side of Henry we haven't seen before.
Like he's finally getting it. Yeah, it's almost as if stepping away from the system gave Susie a clarity that Henry, who's still in the thick of it, is just starting to grasp.
Interesting.
She shares this really insightful thought with him. Good judgment comes from experience. And experience often comes from making bad judgments.
Powerful stuff.
It is. It reminds us that we're all constantly learning and growing, our mistakes.
Those bad judgments, they're not failures. They're like stepping stones.
Yeah, stepping stones on the path to understanding.
And that ties back to everything we've been talking about.
Mhm.
You know, the cultural differences, the biases, the pressures that shape how we see things and make decisions.
It's a call for humility, for being willing to look at ourselves honestly and recognizing that good judgment isn't something you achieve, it's an ongoing process.
Susie's story, with all its real-life examples and honest reflections, it really gives us a look into the human side of healthcare.
Definitely.
It makes us question our assumptions, confront our biases, and ultimately try to understand ourselves and the systems we're part of better. It's a reminder that even in these really tough and demanding fields, there's always room for compassion, critical thinking, and learning.
So as we wrap up this deep dive, we want to hear from you.
Yeah, what resonated with you most in Susie's journey?
Head over to our social media and share your thoughts with us.
And if you want to delve deeper into these ideas, we highly recommend checking out The Agency Worker by The Maverick. You can find a link to buy the book on Amazon in the episode description.
And for those who want to help us keep making deep dives like this one, You can find donation links in the episode description as well.
Until next time, keep exploring, keep learning, and keep questioning those assumptions.
We'll see you on our next deep dive.